Next question. Hey, Dr. Islam, going back to our IBS topic. Hey, Dr. Islam, are there medications that we can recommend when it comes to IBS? And the answer is yes, there are. It really just depends on the type that you have. There are a couple different types. We have IBS-C, constipation predominant, in which we have specific constipation medications to help out with both pain and bloating. Typically, we will use these if patients have not benefited from over-the-counter treatments or dietary options. We have IBS-D as well, diarrhea. We have a few medications for that, more medications for IBS-D than IBS-C. Once again, we use this for patients who have not responded to dietary changes, Imodium, maybe some Lomotil as well. We have a lot of effective options for that as well. We have IBS-M, which is a mixed pattern in which you fluctuate between diarrhea and constipation. And what we do for these patients, and I'll tell you my personal experience with this is that most people actually are mainly constipated with some overflow diarrhea causing the diarrhea. And so I try to really get them going and flowing. I try to focus on their constipation more than I do with their diarrhea. And once we can get them going, then we can kind of titrate to see what options we can do to hopefully get them feeling better. But we try to focus on the most predominant symptom when it comes to that as well. And we have different medications using for each one of these subtypes. And the choice to use a medication would really depend on what your main symptoms are. Do you have a lot of bloating? Do you have a lot of pain? Have you tried other things in the past? Did you have side effects from that? Do you have a gallbladder present or not? There are a lot of different questions that I would have to answer to allow me to determine which medication option I would put you on. And then based on that, we can come to an option, we can come to a choice. And sometimes, and I try to stress this with my IBS patients, it may be a mix and match. We may have to try dietary changes with one medication, but maybe try a different medication instead. And that's the difficult thing when it comes to IBS, is that there's not one size fits all. For some people, we have to try to target the gut microbiome. For some people, we have to target the nerves of their GI tract. For others, we may have to target how quickly things will contract inside your colon. So depending on what the cause is and what we think is going on, that's going to determine what treatment options that we do for each individual patient.